very, very much. Also, stepchildren, Sarah and Alex. Let me also talk about Pat Flanagan. Pat died yesterday. Lawyer in Dayton, partner with Flanagan, Lieberman, Hoffman, and Swaim. Provided me with good counsel many, many times over the years. Chairman of the Montgomery County Republican Party for a number of years, member of the Republican State Central Committee. An amazing trial lawyer. He and my friend Bill Skink would team up. It was quite a pair. I just say this about Pat. Pat was someone that when I was trying cases, you know, you'd love to try a case with him, but it would also just to be almost as much fun to be trying a case against him. He was a fun guy. He was very good at his craft, and I'm going to miss him very, very much. We send our condolences, Fran and I do, to his wife Florence, son Chris, and his daughter Ann. Let me start today with Dr. Andy Thomas. He's joining us by Skype. Dr. Andrew Thomas, Chief Clinical Officer at OSU Wexner Medical Center, as he's been advising me, my team throughout this pandemic. He was involved in helping us develop our public health advisory system, that color code that you're now seeing every week that we talk about. And Dr. Thomas, thanks for joining us. We appreciate it very, very much. Appreciate your time. And why don't you talk a little bit, because we're going to be talking later in this press conference about the color code and what the changes are. Every week we're going to announce the changes, usually on Thursday. And I know the data team went over the data yesterday and into today. But before we show everyone what changes there have been, I wonder if you could just describe for us how this system works. You have 7 indicators. How did that all come about?
Thank you, Governor, for the opportunity to be here today and to be involved in the process. I think a couple of important messages in summary about the public health advisory system. One would be what you just mentioned. It's not based on any one single metric. It's based on a group of metrics that when you look at the trajectory of each and every metric, you see a trend that will, for any one geographic area of the state, provide an early warning that there are issues related to COVID-19 that need to get the attention of either local healthcare providers, local businesses, local schools, really the population in general. It's not meant to be a grade. It's not meant to be any sort of anything beyond a warning, much like a weather forecast might be, a warning of a storm coming in the future. It doesn't do much good to get a weather forecast when you can already see it raining outside. What this system is designed to do is to look forward. Where is the virus going in our community, to make sure that the proper messaging, the proper steps are taken in that community to try and reverse any trends of worsening infection. So it's not just one metric, it's a collection of metrics. That way any one metric might be imperfect, but if you have 3 or 4 or 5 metrics all trending in a worsening direction, it helps make sure that you're giving accurate information out to a region of the state. And then, as I said, it's really meant to be an early warning. Now, there are a number of the 7 indicators. There are 5 that I would call leading indicators. They're showing where the virus is going. What's the trajectory of where it's going in the last week or 2 and into the next couple of weeks? The first, and probably, I think, in some ways the most important of the 7 metrics, although they're weighed equally, is new cases per capita. What per capita means is normalizing the number of new cases based on the population size of the area. So what this metric does is takes the total number of new cases over the past 2 weeks, and it looks at what is that rate per 100,000 citizens. So that allows us to normalize for a larger county like Franklin County, a medium-sized county like Stark County, or a smaller county like Athens County, to determine what's an equivalent rate of cases per 100,000 people. Based on CDC guidelines, anything above 50 cases per 100,000 in the past 2 weeks would be considered moderately high incidence of new cases. Anything above 100 is high, and anything below 10 is yellow. So the impact on the system would be if your county is less than 10 cases per 100,000, no matter what any of the other metrics say, your county is going to be yellow because the incidence is so low. If you're above 50 into that moderately high category, then you are going to trigger this metric. And if you trigger it and stay above 100 cases per 100,000 over the next 2 weeks, then the metric will not untrigger and you'll remain either red or higher. So this is in some ways a very important metric to look at what is the burden of this illness in our community over the past 2 weeks, and then the trajectory of where it's been and where it's going. 3 other metrics that are also considered leading indicators deal with looking at trends of worsening data over a 5-day period. 2 of those relate to symptoms that patients describe when they either go to the emergency department or when they go to their provider's office. The symptomatic surveillance of viral illness is something that's been used for years in influenza. It's something that we have trending data on, and we can see if there's a rapidly increasing trend over the last few weeks of 5 days in a row of sustained increase in either in the emergency department or in providers' offices of people coming in complaining of viral illnesses. That will flag those 2 metrics. And the other metric, which is also a leading indicator, is about sustained increase in new cases. So what this does is take all of the new cases as they're reported based on the date that the swab was done, not the date that the test is returned. And it looks, once again, on a 7-day rolling average for a 5-day trend of increasing cases over the past few weeks to see that the disease is escalating in terms of the actual number of new cases. So different from the first metric, which is normalizing it based on the population, this is normalizing that trend based on that county's previous history. So if they're increasing in terms of the absolute number of cases compared to their baseline, that would flag. And the last of what I would call a leading indicator relates to congregate settings. So what we really want to try to measure with this alert system is what's going on in the community, not particularly in a congregate setting, although we care very much what goes on in a nursing facility, a local jail, or a local prison. To some degree, that may not have a lot of impact on what's actually going on in the rest of that community. So this metric is designed to not flag if greater than 50% of the cases each week over the last 3 weeks have actually just been in congregate settings. But if in any week in the last 3 weeks, greater than 50% of the cases are in the community of the new cases, then this metric will flag, which shows that there's community spread, not just in congregate facilities that may be driving the total number of new cases. Those are the 5 what I would call leading indicators, and then there are 2 lagging indicators, and those mainly relate to hospitalizations. We know based on data that's been published that from the time someone contracts COVID-19, they typically don't end up being admitted to the hospital the next day. They're typically sick or symptomatic for a period of time, oftentimes 7 to 14 days before they even present for hospitalization. What these other two metrics look at as somewhat lagging indicators look at the rate of new hospitalizations by the county of residence for the patient. So it's not based on the location of the hospital, it's based on the zip code where the patient lives. And what that looks at is, once again, a sustained 5-day increase in the 7-day rolling average for new admissions to the hospital for patients with COVID-19. That will flag the metric. So once again, a rapid increase over a 5-day period. And the last metric really relates to hospital capacity. It is about how many ICU beds are filled in an entire region. So for those who aren't familiar, the state is separated into 8 emergency management regions, and we have managed this illness through the Ohio Department of Health and through the medical community based on those 8 regions, whether it's supplies, whether it's testing, whether it's how we manage hospitalized patients. So we look across those 8 regions, and if any region has had greater than 3 of the last 7 days with more than 80% of their ICU beds occupied, that will flag the metric. Now, they don't have to be occupied with COVID patients, but what this is a metric of is how full are our hospitals, because if all of the other things are trending, showing worsening signs of COVID-19 in our community, will there be hospital beds, not only to take care of those COVID patients, but also patients who are having heart attacks, strokes, traumas, and other things. So if you get above 80% for an entire region, the counties in that region will flag for that metric. So once again, to summarize, 7 metrics, not one. It's a mix and a balance of those. And it's really meant to be an early warning system to forecast where it's going in any one community so that the citizens of that community can take appropriate action to reduce the spread and bring it back under control. I should mention that the way the color coding system then works is if your county flags 0 or 1 of the metrics, you're yellow. Or as I mentioned, if you're less than 10 per 100,000 over the last 2 weeks, you'll be yellow. If you have 2 or 3 of the metrics that flag, you will be orange. If you have 4 or 5, you're red. And if you have 6 or 7, you're purple. Governor, I think if you have any questions, I'd be happy to go through them, but that's my basic summary of the system.
Well, thank you very much. I think that's a great explanation, a lot better explanation than I did last week. So that's why we asked you to come in and give
you did wonderfully, sir.
Give the explanation. So I live in a county that is, let's say I live in a county that's yellow. What should I think about all this, and then do the same thing for orange and red and purple? Maybe start with the yellow. We still have a lot of counties that are yellow. We're seeing things change today, but what should I be thinking about this?
So that's a terrific question. I think one of the things you should note about the map, I know you're going to go through this later in some detail, is that none of the counties are green. The reason none of the counties are green is no matter what county you live in, you are at risk for contracting COVID-19. There is activity to some degree across the entire state. Until we have a vaccine or until we have a pharmacologic medication treatment that is known to stop the incidence of the disease and the spread of the disease, no county really will be anything less than yellow, because no matter where you live, you are at risk for this. So I think as it escalates from yellow to orange, that will tell you that the incidence in terms of these metrics is showing that there's more disease in our county. Now, I think last night, sir, in your speech to the state, you made, I think, a terrific plea to citizens outside of the red or purple counties to wear a mask. I think one of the key things that individuals can do to try and stop the spread of this disease is wear a face mask. It's what we call source control. Some small percentage of patients who have COVID-19 are what are called asymptomatic positives, or in some cases pre-symptomatic. So for up to 48 hours prior to developing symptoms, you could potentially infect other people. Through no fault of anyone, in that case, if you have no symptoms and don't know you're ill, you could be spreading that disease to your neighbors, to your families, unless you wear a mask, keep 6 feet distance between you and others that you don't live with routinely. Wash your hands routinely with either soap for greater than 20 seconds or with hand sanitizer. And then certainly cleaning high-touch surfaces. That's mainly something for businesses in terms of countertops, doorknobs, elevator buttons, and so forth. But no matter what county you live in, those 4 things, face masking, social distancing, washing your hands, and cleaning high-touch surfaces are the things that all of us should be focusing on to make sure your yellow county doesn't become orange, red, or purple, regardless of what the current rate might be.
Orange as opposed to yellow, what's that tell me?
Well, I think orange means that the storm's getting closer. It means that the wind's getting a little stronger. It means that there are either more cases or an increasing incidence of individuals saying they have symptoms of COVID. It may flag because suddenly what used to be a problem in a local nursing home is now a problem in the community. So it's once again going from either 0 or 1 indicator flagging to 2 or 3 just tells you that on average the data is getting worse for your area. Not enough to be red, but certainly worse than yellow. So I think once again, more focus on those 4 interventions: wearing a mask, keeping your social distance, washing your hands routinely, and then washing high-touch surfaces.
In red?
Well, red, based on the public health order from a couple of weeks ago, red requires face masking when out in public, when you have a reasonable expectation of being around other people. So if you're out walking your dog on the sidewalk and you're not going to stop and talk to your neighbors, you don't need to wear a mask. But certainly if you're going into local businesses or you're going to be directly interacting with others, not kind of outside of those you live with in your home, you really need to be wearing a mask in those red counties. You know, when you think about it, Governor, there's a reason why surgeons have worn masks in the operating room for over 100 years. It's not really particularly to keep the surgeon from being infected by whatever they're doing with the patient. It's because we know that when the surgeon breathes or the anesthesiologist breathes or the nurse breathes, they're breathing out bacteria that can cause a wound infection. So the source control of a mask is really important if you're one of those asymptomatic positives. It keeps you from having others be at risk of spreading the disease. It's the primary use of the face mask. At the same time, if someone else either doesn't have a face mask on, or even if they do, but maybe they're not wearing it perfectly, they're wearing it below their nose or whatever it might be, you wearing a mask also can protect you for those droplets that are in the air because that person's either not wearing the mask correctly or not wearing one at all. So mainly the mask is to protect others, but it also provides protection for yourself.
And purple?
Well, I think purple is, we haven't had that experience yet. We've had a couple of counties that have been flagged for potentially moving to purple. I think almost by definition, that means that you are flagging the 2 hospitalization metrics, either that your hospital ICU beds are generally full across an entire region, or the residents of your county have an increasing hospitalization trend. I think it's obviously the most concerning set of circumstances. It's the disease is not only trending worse, it's kind of already there and bad. And I think purple is where certainly local health leaders, local community leaders really need to think about other options that they may take to try and stem the tide of the disease beyond where we're at with the face masking order for red. I think in no uncertain terms, it means that the storm is there and the winds are blowing really hard. And if something isn't done about it, it will just continue to worsen, somewhat like what we're seeing in Florida or Arizona or some parts of Texas. It's there, and it's going to take a while for that storm to recede. Yeah. So the goal is to have no one ever have to get to purple. Like I said, this is not a grade. This is a warning system, an alert system that will help people understand when they need to step up their I mean, I personally wish people would wear face masks, as I said, in the yellow or orange counties without needing to be ordered to do so. I think that would be one of the most effective, and I think most medical experts across the state would agree with that, as one of the most effective ways to prevent you from becoming red. But the goal is this is not a grade, this is a warning system and a chance to allow local people in the local community to understand what's going on so that it's not one score for the state, but it's really tailored to what's going on in your local environment.
Great. Dr. Thomas, thank you. We appreciate it.
Thanks for having me, sir.
Thank you very much. Lieutenant Governor.
Thank you, Governor. Good afternoon. We do want to thank Dr. Thomas for all the work that he and the team put into that system, just to try to help people understand where things are going and to give them that early warning that things are trending in the wrong direction, and also hopefully if we do things right, trending in the right direction. Today I want to just spend a few moments on talking about the connection between health and health interventions and our economy. And if you recall, early on in the process, one of the contributing factors that led to the shutdown of many of the things that we hold dear was the fact that we did not have an adequate supply of PPE, of testing, of all kinds of things that are essential for healthcare workers and for public health officials to manage the disease, the virus, the pandemic. And today, well, in that process, we had a number of manufacturers who stepped up, who helped fill the gap. But we know that we don't want to find ourselves in this position again. We want to sustain the production of PPE in our state so that those businesses can supply other places, but also mostly so that they can help make sure Ohio and hospitals and first responders and nursing homes and places like that have the adequate supply of PPE. So we're announcing today a $20 million grant funding program through the Development Services Agency to help manufacturers produce much needed personal protection equipment. Now, Ohio PPE Retooling and Reshoring Grant Program. For employers across the state, we know that they need it. We know that they need access to the PPE, and many Ohio companies have reached out and looked to get that supply, and we're going to continue to try to help these businesses build that supply chain. It's important that all aspects of the supply chain are part of this production, and we are confident Ohio companies will continue to innovate and find solutions for this shortage, and we're announcing grant funding for 68 Ohio manufacturers that will help make that happen. So 68 companies are going to receive these grants up to $500,000. Not all of them are $500,000, obviously, but up to $500,000 to retool or expand existing facilities in Ohio so that they can purchase equipment and upgrade the technology to produce and compete in this space. And projects are expected to create 829 new jobs and retain 1,133 existing jobs. And more than half the awards went to small businesses with less than 25 employees. So this is an important part of the economic development strategy that supports the health strategy that helps keep Ohio open for business and people employed. And while we're on the topic of PPE, we had a great call this morning with Jobs Ohio and Undersecretary from the State Department and a number of businesses from around the country to talk about reshoring more of this production to America and to Ohio. And Jobs Ohio and the people, the state of Ohio has procured approximately 65 million pieces of PPE, including masks, gloves, gowns, coveralls, thermometers, and the like, through the Department of Public Safety, Ohio Emergency Management Agency, Department of Administrative Services, and of course, the Department of Health. More than 50 million pieces of that PPE have been distributed across the state to the people who need it in business, in healthcare, on the front lines. And we worked to fill the most urgent requests with those acquisitions. And we want to acknowledge the work of Jobs Ohio that to date has allocated nearly $70 million for more than 40 million units of life-saving PPE. Additionally, what Jobs Ohio is going to be starting for Ohio's small businesses next week is that they will put together kits with their 6 network partners, the Jobs Ohio partners across the state, to distribute 15,000 PPE toolkits for a total of 1.5 million 3-ply masks, 150,000 KN95 masks, and 15,000 bottles of hand sanitizer. Trying to get that out there so that we're not only distributing it, but we're using it, because we know, particularly in these hot spots, it's important. And we're going to be working with Chamber of Commerce's and urban leagues across the state to get that distributed. There is no doubt a big connection between our effective response to COVID on the health side and our economic growth as a state. And I want to emphasize something that the governor said last night. I thought that he did a really nice job of talking about the health of our citizens and healthy economy, and a couple of studies. So the Goldman Sachs research that talked about expanding masking by just 15% compliance could prevent the need to bring back stay-at-home orders and otherwise cost an estimated 5% of the U.S. gross domestic product, which would be close to $1 trillion. Those are numbers, and we talk about GDP and big numbers, but what we're really talking about here, these are jobs. We get this right. We continue to keep the coronavirus under control and move that curve instead of up, but in the other direction as we're experiencing this surge. It's incredibly important to keep businesses open and to keep those jobs available for people, because a job is the way you pay your mortgage, the way you pay your rent, the way you take care of your family, the way that you pay for your essentials and look out for your future. So we talk about big numbers and GDP and things like that. It's about real people. It's about their jobs. It's their lives and livelihoods, and finding a way for both of those to flourish. And all of these things are connected. And Ohioans have been getting it right. You look at what's happened in other places, but we just got to keep getting it right, not get complacent, and see this through. And when we do, our health and the health of our economy will benefit. So appreciate all the work that is happening out there to make this happen. And Governor, turn it back over to you.
Thank you very much. Eric, we'll go right to the numbers. So we have today's numbers, and we'll put that up on the screen. As you can see from top cases, 1,290 new cases, much higher than it was a couple of weeks ago. It's been trending in that area. The deaths, last 24 hours, 28 deaths, which is higher than the 21-day average. Also the hospitalizations, 115, higher than the 21-day average of 87. And ICU admissions are up as well. Let's look at the next slide, Eric. This is a trend that we are seeing. This is COVID patient count in Ohio hospitals. These numbers, as you can see, are going up. You're also seeing a trend going up in regard to those who are in ICU. Not a sharp increase, higher increase in numbers of those who are in the hospital. So this is a snapshot, how many COVID patients are in the hospital in one given day. So let's go to the new map. Dr. Thomas talked and explained this. I think did a very, very good job. And what you'll see is there is good news and there is bad news. And so let's start with some good news. You'll see Hamilton County, Butler County, Cuyahoga County are still red, but they're off what we call the watch list, that would lead us going towards purple. So that is good news, and I'll go through each one of these counties. Also good news that Trumbull County in the Mahoning Valley has dropped down one notch as well. We certainly hope that the people in Trumbull County will continue to wear masks, but that is the new, that's the good news. We have bad news as well. But what we saw, for example, in Hamilton County, I just talk for a moment about Hamilton County because more people are wearing masks by every account, everyone I talk to. I just got off the phone with health commissioners from throughout the state of Ohio. You also had in Hamilton County the business community coming together, Procter & Gamble, supplying masks, their Mask On campaign. So a lot of good things coming together in Hamilton County as far as people wearing masks and becoming more cognizant, becoming more aware of the social distancing. And so what you really have seen is, the level was going up. That level may now be approaching, I'm not sure it's quite there yet, but it may now be approaching a plateau. So still at a high level, but slowing that increase down, and that's why you see with the Hamilton County, for example, they're not in fact moving up, and we've taken them off the watch list. A new county, unfortunately. Let's go over to Athens County. Athens County, the situation there has rapidly accelerated with isolated outbreaks that have resulted from a concerning community spread. Athens County has more COVID-19 cases in the last 2 weeks than they've had over the entire time of the pandemic. Really shocking. People visiting their doctors with COVID-19 symptoms have skyrocketed, gone up by 700% over the last 3 weeks. Local health officials report at least 3 outbreaks at local bars, all of which have temporarily closed due to their staffs having cases. So as I talked to the health director today, health director described that area right downtown has been a huge problem area. We'll go up to Allen County, Northwest Ohio. Large surge, had a surge of 76 cases over the last 2 weeks. This is not just from increased testing, as more and more Allen County residents are seeking care from their doctors and from the ER for COVID-19 symptoms, the early indicators that Dr. Thomas talked about. Local officials have noted isolated outbreaks at a restaurant and another workplace. Allen County has reached a tipping point regarding this virus, hitting majority of our indicators. Delaware County. We're seeing a surge of cases, Delaware County and Central Ohio. Delaware County, with 174,000 residents, has had 233 cases over the last 2 weeks. Just for kind of an interesting comparison, this is more than the entire country of Ireland. Population 4.9 million had over the same period of time. Over the last 3 weeks, we've seen the amount of people going to the doctor with COVID-19 symptoms in Delaware County double. This is why Delaware County is triggering so many of our indicators. Local officials also note a number of travelers who have contracted the virus, they think, while in Florida and coming back from Florida. Also in Central Ohio, Licking County. Licking County is in a similar situation to almost all of Central Ohio. Licking County, with 166,000 residents, has had a surge of 159 cases over the last 2 weeks. While some cases have come from long-term care facilities, almost 3/4 of the cases have come from outside congregate settings, indicating significant community spread in the county. Local officials also note a small outbreak at a house of worship. Lucas County. Lucas County is a higher populated county, obviously, but their numbers have moved into an area of concern with 393 cases over the last 2 weeks. The average number of cases has more than quadrupled over the last 3 weeks. ER visits have doubled. People seeing their doctor with symptoms have tripled. Lucas County has reached, again, a tipping point. Local officials note an outbreak at a long-term care facility as well as at a recent funeral. Richland County. Richland County is also now a red county. They've seen their daily case average double over the last few weeks. While it is a smaller county, 124,000 residents, Richland County has had more cases over the last 2 weeks than the entire nation of Jamaica, population 2.9 million. More and more Richland County residents are seeing their doctor and going to the ER for symptoms. These signs all point to Richland County reaching a critical stage in this pandemic. Local officials note outbreaks associated with a restaurant and a birthday party, in addition to multiple long-term care facilities. Scioto County, Southern Ohio, has seen more cases in the last 2 weeks than it has over the course of the rest of the pandemic. More cases in the last 2 weeks than it has seen over the course of the rest of the pandemic. Almost all of these new cases were from outside congregate settings, not in congregate settings, indicating widespread community spread. More people are going to their doctor and being diagnosed with coronavirus. Local officials note an outbreak at a daycare center and at least one other workplace, as well as just general community spread. Union County, back to Central Ohio, mirrors that of the rest of Central Ohio. Daily average cases have quadrupled over the last 3 weeks. More and more residents are seeking medical care for COVID-19. Almost all new cases have been outside congregate settings, indicating significant community spread in Union County. Union County has experienced new cases due to travel outside Ohio, including to Arizona, Florida, North Carolina, as well as routine travel to and from neighboring counties. Let me go back to Butler County. As I said, some good news. Butler County has moved off the watch list this week. They're still on red, but off the watch list. However, the county continues to be red as it has been. The number of cases in Butler County is still increasing, but at a slightly lower pace than during the previous week. Butler County residents are continuing to seek medical care for COVID symptoms in emergency departments and outpatient settings. Butler County, with 368,000 residents, has had more cases during the past 2 weeks than the entire country of Denmark, population 5.8 million, has had during the same period of time. Claremont County continued to have a concerning increase in spread in cases. During the past 2 weeks, Claremont County has had 130 new cases, which is 24% of their total cases since the beginning of the pandemic. Additionally, outpatient visits have tripled during the past 3 weeks. To put in perspective, Claremont County, with 197,000 residents, has had more cases during the past 2 weeks than the entire country of Finland, population 5.5. Almost all of the new cases have occurred outside of congregate settings, indicating significant community spread in Claremont County. Up to Cuyahoga County, still at a critical stage. They are averaging 179 new cases per day, an increase of 49 additional cases per day since June 23rd. Outpatient visits for coronavirus more than tripled during the past 3 weeks. The county is very close to meeting the threshold for new hospital admissions. Some new cases are being driven by out-of-town travel and recreational activities. It's critical that the residents of Cuyahoga County remain vigilant and do all they can to reduce their risk and exposure to the coronavirus. We're continuing to monitor that as well. Back to Hamilton for a minute. Again, it remains red. Local health officials have said that number may be plateauing or getting close to plateauing. While leveling off, the number of cases in the county certainly remains high. During the previous week, the county registered more than 1,400 new cases. The number of people seeking medical care has increased 2.5 times during the past 3 weeks. And 3/4 of new cases are outside congregate settings, including an outbreak at a high school, multiple workplaces, and restaurants. So those are the counties, as we said, that are red. The order will be that at 6 o'clock tomorrow night, as we have done in the past, those counties will have a mandatory mask order. That will mean that approximately 60%, as of 6 o'clock tomorrow night, approximately 60% of the population of the state of Ohio will be living under a mask order. I also want to do a shout out for Walmart and Kroger, and there may be more I may have missed, but just in the last day they have all required masks to be worn. We've talked about masks a lot, but as I said last night, the jury is in. The verdict by everyone really who has looked at this in the medical community and the health community overwhelmingly, that masks do make a difference. I am cautiously optimistic what we've seen, particularly out of Hamilton County, that is moving, and it's moving in the right direction. And so my message to my friends who are in yellow counties or orange counties, please wear those masks. We're not putting an order on yet, but this is how you can keep it where you are, or maybe even go to a lower degree of spread. Looks like it is working in Hamilton County. It's still early, but we're making progress. So this is the right thing to do. We've got to slow this thing down. Let me make one more comment. There will be liquor control hearings on August 3rd, 4th, 5th, 6th, and 7th. The Ohio Investigative Unit is a unit that normally focuses on liquor violations in the bars across the state of Ohio. They're a part of public safety. They're also, of course, now enforcing the rules regarding social distancing and mask wearing in these establishments. So we had a conversation today, as I said, with the Departments of Health. Also had a conversation with the Ohio Investigative Unit team. And so they will be following up, continuing to do their work, focusing on bars. Let me just say, most bar owners are doing a good job, but we do have bar owners out there who are not doing a good job. And so we've asked the health department to pinpoint those, and that will be work that's going to continue to be done by the Ohio Investigative Unit. We'll now open up for questions.
Good afternoon, Governor. Marty Schladen, Ohio Capital Journal. First of all, I want to thank you for taking the time to talk to us in the press. I know you don't have a lot of it, but this is important. You said that you're not going to enforce your mask orders, saying instead that the intent is to get people to comply voluntarily. By that logic, why should I be arrested if I slam a six-pack and drive down I-70?
Well, I don't think we quite said that we're not going to enforce it. What we said is we're not looking to lock a lot of people up. That's not the idea. The law can be a teacher. We are seeing that, for example, in some of our counties today where the mask order has fundamentally changed people's behavior. I think that without an order from me, people are beginning, I think, to understand the gravity of the situation. I think they're seeing the importance of wearing a mask. We are enforcing this, and you know, as I just talked about, our investigative unit will be out again this weekend. They'll have additional people. They will be going into bars and making sure that the bar is complying with its social distancing. And again, I think it is a change in culture that we're looking for. We are not a people historically that wear masks. That's just not what we do. But we all are adjusting now to the new world that we live in. And the new world is that if we're going to make it, if we're going to continue to have businesses open, if we're going to continue to be able to do some of the things that we want to do, wearing masks out in public is very, very important. So the answer to your question is the law is a teacher. We're not saying that there won't be occasions of flagrant violation of this, that something might not happen. So again, we're asking people to do this. I think it's the same situation that you're finding in other states as well, and people are doing it.
Thank you.
The state now will be under by tomorrow night under that order.
Governor DeWine, this is Laura Hancock with Cleveland.com. You've talked a lot about counties needing to work hard to head off becoming purple. You acknowledge that in Southwest Ohio that's been prevented. And I was just wondering what goes into place when a county becomes purple that would be different than when they're red. Besides the mask order, which they already have if they're red, what happens when you become purple? Why is that so bad?
We have not tied anything to that, and I go back to what Dr. Thomas said, who was involved in putting this together. We have heard for some time from counties who have said to us, look, you know, we're different. You know, we're a rural county. We don't have as many COVID cases, et cetera. So what we decided to do is to really be able to inform people every week on Thursday, it looks like, and we're going to tell you where your county is. And as Dr. Thomas said, this is an early warning sign. This is like getting the weather report. This is saying, hey, there's a front moving. It's coming. You better take shelter or you better start doing something. What's different about in the weather is that the weather we can't do anything about. We can take shelter, and that's about all we can do to impact the weather. In this case, we can do something with this information, not just take shelter, not just look outside and say, hey, it's going to rain in an hour. I won't go out and water my plants because they're going to get rained on anyway. But it's very different with this type of information. This type of information is usable. And what it really says to people is, this is where my county is. So I know that right now around Ohio, there are people who are said, well, that can't be. You know, they look to their spouse and they say, well, that can't be. Our county can't be red. Well, they are red, and they're red for a reason. And they're red because we are seeing these early indicators. And so this is to inform people in Ohio in a specific county, here is what your situation is. And what we're starting to see is, look, it's early, but what we're starting to see, for example, in Hamilton County, some in Butler County, and other counties, is they're starting to get it and say, okay, we do have a problem. We don't want to be Florida in 3 weeks or 4 weeks. And if we don't want to be Florida, we got to do something now. So it is to inform people. And I'll go back to something that I've said time and time again. And I said this last night. We fixate a lot, I understand that, on what Mike DeWine orders or what the health department orders or what your local health department orders. But the truth is, no matter what I order or don't order, the most important players in this game are the 12.7 or so million people in the state of Ohio. You control where Ohio is going so much more than I do. And we have these colors because we want to be able to tell you, for example, Central Ohio is red hot. We want to be able to tell you Southwest Ohio, we have some challenges here. And then we got a surprise probably. If you're in Scioto County, you may not have seen this coming, but this is an early warning. Hey, we got a problem in Scioto County. And you could go around to Athens, and you could, every other county, Richland County. And so that's the purpose of this. It's to inform the public in that county so that they can take action. And we ask them to take action.
Thank you.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. Your message last night was about pleading with people to take the virus seriously, to do what they can to wear a mask. How will you know if that message sunk in? What kind of metrics are you looking for to tell you that it is shifting in the right direction? And what will you do if the numbers continue to get worse?
Well, I think we can see a difference. And I'm not saying we can see a difference since last night, but we can see a difference in some of these counties. I think you're seeing more people who are wearing masks. So one very tangible way is to see how many people are wearing masks. And look, I get calls, I get texts from people who say, look, my child can't wear a mask. There's a medical reason. So I would just say, look, if we're all in this together, if there's a child or there is someone who is not wearing a mask, do not assume that they are in defiance of what the order is, and don't assume that they don't care about other people. So, but I would say, the vast, vast majority of us can wear a mask, at least when we go into a store. And that's really what we're asking people to do, is to make a minimal commitment, a minimal sacrifice, a short-term sacrifice for a long-term gain. And the long-term gain is kids will be back in school in the fall. Long-term gain could be our kids can play football, our kids can play basketball, whatever it is. Look, we don't know what the future is, but we can impact that future, certainly by what each one of us do. So that's really what we're looking for. We're looking for people in what they do every day. And again, when I see significant companies in the state of Ohio who are saying, you come into our retail establishment, you will wear a mask. Everybody's starting to get it. And again, you may have a small number of people who, for some reason, can't. God bless them if they can't wear a mask, that's fine. But the vast majority of people can wear a mask, and we're asking them to do it. And I think we're starting to see some certainly movement in that direction.
What's the or else scenario of do this or else? What's going to happen if the numbers don't get better?
Look, as I said last night, as governor of the state of Ohio, I will do what I have to do to protect the people of Ohio. And that's what I'm going to do. Now, we're going to constantly look and see. I had a good conversation, for example, today on the phone. We had most of the health directors from all over the state, and just asking them, what are you seeing? What type of things are causing the problem? So these are the notes I wrote down. These are my notes. I wrote them in the car, and I'll just read them in no particular order. And I don't think they're not meant to be in order, but these what came up: block parties, literally people getting together in block parties, neighborhood get-togethers, bars, churches, mention, of course, about young people, and the data's clear. 20 to 29-year-olds, the numbers have gone up, dramatically. Travel, people coming back from traveling, and from hotspot states, restaurants. These are just some of the things that I wrote down. John, I don't know if you had any more. You were on the same call I was, but
it was. Look, it's. As you listen to that list, and I heard, I was listening to the same call the governor was, what people are saying is that what we're hearing from health officials is just people's individual responsibility. In some cases, they're not living up to it in the sense that they are not following the rules that we all have encouraged people to follow of the distancing and not gathering together in large groups. And I get it. It's like you see your family like, well, this is my family. They don't. Well, your members of your family, my family, anybody's family who hasn't been following the recommendations and exposing themselves can then turn quickly and expose 10 of their family members to it. And it's what people do. You may say, I'm doing great 8 hours a day at work. There's a great working environment. But if just one of you in that group kind of deviated from that, went out, did something that maybe was a little more risky, contracted coronavirus, you're walking around asymptomatic, you're shaking hands, giving hugs, doing the things you've always done, that's a recipe for disaster, for the spread. And it can happen just like that, where one person gives it to four give it to 12, and it can spread pretty quickly. So it's just everybody in their personal lives making good decisions so that they don't put each other at risk. And that's what we were hearing from the health department officials today, that they were really on the governor about just share that message about people needing to do these things. And he does it every day. I don't know that the governor could implore people to do this more than he has. He does it every day. And the more we listen to his advice, the better off we're going to be in the long run.
Andy, let me just answer the question this way. And one of the things that we're seeing, and this came up on this call, and that is people say, well, people's own home, and they have in the backyard or inside, obviously more dangerous, 75 people. And, because we don't restrict what people do in their own home, people look at that and say, well, that's not part of the order, and I don't have to do it. And so what we're really asking people to think about is, don't think so much about what the order is, but rather think about, does this make any sense for my family? Does this make any sense for everybody else? And so to answer your question directly, I will do whatever it takes to keep people in Ohio safe.
Thank you.
Hesitated before, I'm not going to hesitate again. But the better pathway, obviously, is if people will look at these colors. If you're yellow, try to keep from going into orange, and if you're orange, try to keep going into red. And if you're red, do everything you can to push it back. So we're trying to inform people with this.
Hello, Governor. Kevin Landers, WBNS 10 TV. I'd like you just to clarify again what purple means. Does that mean a county could possibly shelter in place? Does that mean you would institute a quarantine for people who are leaving the state, for example, going to Florida? What exactly does that purple trigger? And then, we have a state of 11.7 million people. We had 1,000 new cases today. That's not a large percentage of the population. Can you explain why that is such a concern?
Why which is such a concern, Kevin? I'm sorry.
We have 1,000 cases, 11.7 million people. That's not a large percentage. Can you explain why that is such a concern?
I talked about this last night, and I understand it doesn't look like a huge number, but we are basically where Florida was a month ago. Florida was at this level. If you look at positivity, if you look at number of cases, look at all kinds of different ways, and see where Florida is today. And so, look, we see these things coming. This system was designed, the color red was picked for a reason. It is a danger. We have challenges. It's a warning system. So what we've learned throughout this pandemic, and what, frankly, the scientists told me very early on, in February, they said, you have to move well before it looks like you have to move, because it goes out and multiplies out like this. So, for example, if you live in one of these counties, one of the yellow counties, now is the time to cut this thing off. It's so much easier to do it. So much easier to do it with if somebody comes down with it, tracing, a person's isolated for the period of time, anybody they talk with or they come in real close contact with, and you just cut it off. You cut at the knees. And it's so much easier. When you get here, it's harder, and when you get here, it becomes much harder. So you got to look down the road. Now, we are losing a lot of people every single day, and we not only have people who are dying, we have people who have long-term health issues. So I would not, as we look at the number of people who are coming down with this, I would in no way minimize that. But I would also say that the real concern is the future and how this bodes for the future and how this stuff multiplies and it just goes out like that.
Governor, can I emphasize something that I heard Dr. Thomas say, and I listened to a lot of these calls when it was being designed. It wasn't necessarily designed to be a triggering tool. It was designed to be an information tool. It was designed as an early warning system. He talked about it as a weather forecast. It's like, look, you may have some severe things coming at least, but unlike a weather forecast, you can actually do something about this. You can take the precautions individually and collectively to change your future. And that's what we want it to be. We want people to say, hey, this is happening. Maybe I ought not go do that family reunion or whatever it might be that we thought was a good idea a few weeks ago, because we're seeing, a spread. And hey, there's a lot of 20 to 29-year-olds in this group. We know that they've been out doing a lot of things. They could be asymptomatic. Maybe we ought to rethink what we're going to do. That's what we hope people will use it for, to inform, making better personal decisions, taking more personal responsibility in the ownership of the solution.
So, for example, if you're in Hamilton County today, you know more, a little bit more at least, than you knew this morning. And what you know is, hey, we're doing a little better. Maybe some of these things that we're doing and we're putting in place, and the mayor and the county commissioners and other people are urging us to do, maybe some of that's working a little bit. And you know that at least you've slowed that rate of increase down. That tells you something. And tells you something if you're in Scioto County and you say, I didn't know that. I didn't know that this was bad. So again, these are indicators for people to be able to react to.
Thank you.
The question, the next level, the fourth level, we have nothing tied to that at this point. Doesn't mean we might not in the future, but we have nothing tied to that at this point.
Hello, my name is Susan Kratzer with Hannah News Service, and I was just wondering, what's the National Guard, what's the status of their operations right now, and do you have any plans for once aid from them ends in certain areas like nursing homes, will there be just any kind of support after them?
National Guard is today, I believe, doing some community testing, the pop-up tests. They also are in nursing homes. They're going to stay with the nursing homes for another week or so. They're making very, very good progress with the staffs there. We then will, at that point, move to a different system as far as the nursing homes, as far as the testing, where every nursing home will be required within a certain number of days to completely test all staff members, and that will be up to those nursing homes to do that, and we will monitor that, and we will monitor the results. The Guard at that point will move more out into the communities. What I've asked our team to do a few days ago is to look at our mid-level counties, look at our counties that may be getting ready to turn red, and talk to the local officials and see, do you need more testing in the county? Can we come in for a day? Do you want us to come in? You want the Guard to come in, do pop-up testing, say in Mansfield, Lorraine, and so the scheduling of the Guard as we go forward is going to be a lot of it is going to be that community testing. They can come in, they can set up, they can get it done, we can get the results back, and that's helpful to that particular county. So they're going to be on a mission to find places where the local officials believe there is not enough testing. There's not been enough opportunity for testing. And so again, if anyone's watching this today from a county and you don't not think that there's enough testing in your county, talk to your local health department. If they don't think there's enough testing, they will be in touch with us and we will come in with the National Guard. We are very, very happy to have the Guard moving forward. I just signed a letter to the President thanking the President for the subsidy on the Guard, but also asking that that be extended. So we would have more opportunity throughout the rest of the year to have the Guard out 5, 6, 7 days a week.
Thank you.
Hello, Governor. This is Luis Gil with Ohio Latino TV. Governor, I would like to go on the same line about your speech last night. It seems like you were torn delivering your speech. What's the right thing to do for Ohio and Ohioans? So many people were not expecting, they don't know what to expect, but they were not expecting for you to come out and just simply ask, wear your mask. And in short, is it up to us, if all to Ohioans, to come out of this crisis? And in short, what do we got to lose? It's just to wear the mask for 3 weeks or 4 weeks.
Well, Lewis, I was torn. I guess I'm. Anybody in this position is torn. You always wonder, what are the things to say to people. But we scheduled that. It's the first time since I've been governor that I ask, to have time that time of night. We normally do this 2 o'clock press conference, but I wanted to talk directly to the people of the state of Ohio and to lay out for them what was going on, what I was seeing every day, and frankly, what my concerns are. I owe that to the people of Ohio. I owe it every day to tell them what we're seeing. But I want to do it in a more maybe cohesive environment or cohesive speech than I do sometimes when I'm here, because I wanted to tell them that every morning when I get up and turn on the news and I see what's going on in Florida or Texas or California or Alabama, other states, my worst nightmare is that that's coming to Ohio, and we have good evidence. When you look to where those states were a month ago, basically it's where we are today, and we got trend lines. I mean, look at this map, how it has changed 3 times. You've seen it. We now have 60% of the population of the state of Ohio living under red, which means we have very specific problems, and it's moving up, moving clearly in the wrong direction. So it was. As a former prosecutor, I guess it was my argument to the jury, people of the state of Ohio or the jury, and to tell them these are the facts. These are the essential facts that we have. This is what we know today. This is what we have to do to get through this. And what is at stake is what the fall is going to look like, what the winter is look like, our future. Our future as a state is at stake. No one wants to see us shut down. No one wants to see business shut down again. No one wants to see us hunker down. But if we're going to avoid all those bad things, we have to take action. And we have it within our collective selves to change the outcome. We really, really do. So that's what I was trying to do, trying to talk to the people of the state. And look, as I said at the beginning of the speech, there'll be additional orders in the future. But again, whatever those orders are, what's more important is what people do every day. And that's why I wanted to talk at 5:30 when I thought maybe people maybe getting home, people turn on the TV, watch a little news, and they might come across Mike DeWine on there, and maybe they'd listen to a few minutes, and I'd have the opportunity to tell them what was on my heart and what I'm seeing and what I'm concerned about.
Thank you.
Good afternoon, Governor DeWine. Ben Schwartz with WCPO in Cincinnati. Governor, I know you've been answering a lot of similar questions to this today, but I do want to ask, Governor, what will happen if people in counties nearing level 4, like Athens, for example, with a whole lot of community spread, simply don't listen, don't wear masks, and the virus continues to spread? Do you see them going into a stay-at-home order for solely just the county or something like that?
Yeah, Ben, I don't know. You know, we're going to do what we have to do. Local health department's going to do what they have to do. But, you know, buck stops with me. I'll make the decisions. But what really will happen, whether we issue an order or don't issue an order, if it's so widespread that people are scared, then the economy kind of shuts down. You know, you look at Athens, for example. Let's take Athens County. And John and I were on the phone with the health director, along with other health directors on the phone. I said, look, what's going to happen? What's going to happen in the fall when these kids come back to school, when OU is back, and you've got thousands and thousands of kids? So, and that's, you know, that's the concern. I mean, it's July, and we're seeing this in Athens now, so we're concerned. And so it's time. Okay, there's a warning. Now it's time for us to get control of that. And by us, I mean the people who live in Athens, people who run the bars, people who, you know, are there. It's time to get control of the situation, because you're going to have, you know, tens of thousands of students coming back in the fall. Man, it's not just unique to Athens, but it's got a lot of students coming in.
Governor, Stephanie Kuzadum with WKRC Local 12 in Cincinnati. I was wondering, besides the OHSAA, who are you consulting with specifically before making decisions on how fall sports should begin? And what do you hope to learn from them? And what are they advising for the start of competition for both contact and non-contact sports?
You know, I missed part of that, and I apologize. In regard to making what decision? That's the part I didn't get.
In making decisions on how fall sports should begin.
Look, we're monitoring these numbers, and we're looking at, and we're trying to see what is going on. I'll take the first part of that. John's been working directly with schools. I know he's also been working directly with the Ohio High School Athletic Association. So, John, you want to get the particulars on that?
Sure. You would be surprised how many people there are to consult with. We know about the professional teams who we've been consulting with them. We know about the Ohio States, but there's also the Mid-American Conference, other conferences from Division I to Division III who are interested in this at the college level, high school sports. But then you also have AAU and club sports and things like that, and people who own athletic facilities who run sports leagues in them. So you have that diversity of voice It reminds me of the reopening schools. It's hard to come up with one set of plans that address the unique circumstances that everybody operates under, and that's the complexity of this. You want to try to treat people the same. You also understand that there are unique sets of circumstances, and we're doing this in an environment where we've had an increase in the number of cases, and certainly in some parts of the state. So we're trying to balance the fact that we know sports are an integral part of Ohioans' lives, that kids really value them as part of their character and personal and physical development. We understand the magnitude of both and the consequences of either decision. That's why it's taking time to work with all of those different groups to try to get this right. And it's been complex, but when you're listening to all of these voices, it takes time to pull it all together in a changing environment as it relates to coronavirus. So know that it's been a very inclusive process. We understand that there's a need to get this information out, and we're working to come to that conclusion, hopefully here in the very near future.
But let me also point out that this ball game, if I could say this, is constantly changing. We're taking all the information in, but we don't have a crystal ball as far as exactly what this virus is going to do. I mean, what you're starting to see in college, athletics certainly, you're starting to see teams that are being tested, and then you're starting to see what the results are. You're seeing that in the pro sports as well. So, all of that information is coming in. It's information that we are all of us, everyone out there watching on TV, is processing as well. So a lot of this is we're pulling in from all kinds of different sources, and it's a constantly changing and it's a moving target.
Are any of those voices athletic trainers, which are considered healthcare professionals of the sidelines?
Well, we consult with the schools. Athletic trainers are included in that. I don't know that we've talked specifically to an association of athletic trainers. I know we've talked to individual athletic trainers. They certainly, their voices matter in this as well.
Thank you.
Hi, Governor. Tom Bosco with ABC6 here in Columbus. There still seems to be uncertainty as to single patients with multiple positive tests for coronavirus. How are those being counted, and how do those affect the overall counts and the overall numbers that you're looking at in the state?
I'll tell you what I know. My understanding is that one person becomes one case, no matter how many times they have tested, and that process is done at the health department level. John, do you have any more on that?
It's a great question. I get it often. I directly ask the health department about this, and what they explained is that when you get tested, you're going to give your name and you're going to give your birth date, and they cross-match. So even no matter how many tests you've had, they're going to cross-match that and make sure that data is only there for a single individual. If you got tested 3 times, it's going to be deduped into one case per individual, per name and birth date.
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. You declined last night to go to a statewide mask order. With the addition of today's red counties, more than half of Ohio's population is now under a mask order. Governors and health authorities in 24 states now have issued mandatory mask orders, including 6 just in recent days, including fellow red state governors. What do they see, or what do they know that you don't when it comes to imposing a mask order?
Well, as you know, Randy, we were probably one of the first states to impose a mask order for business. So we did that very, very early. And as you just pointed out, we have now 60%, as of tomorrow night, 60% of the population of this state will be living in a county that has a mask order. we may come to that. We may make a decision that the entire state will be under a mask order. What we've tried to do is to do two things. One is to give people the information that they need to make these decisions. Ultimately, order or no order, it's what people do when they go out of their house. Do they put a mask on? Do they have a mask? Do they put a mask on when they go into a business? The trend line is clear, and the evidence, as I pointed out last night, is overwhelming. So I thought I would try Randy one more time with an address in the evening to talk to the people of the state of Ohio about the importance of wearing masks. My experience in life is that people react generally better when you ask them to do something, when you give them the evidence, than they do when you tell them to do something. So I'm trying this, and I made an impassioned plea last night. I think we have the facts on our side. I know we have the facts on our side. Clear the scientific evidence is there, and I'm asking people of the state, no matter what part of the state they live in the next few days, to think about it, pray about it, and I hope that in the next few days they make the decision, even if they're in a county that is yellow right now. They need to know that their county may not be yellow in the future. They need to know that their virus is out there lurking in their county where they live. So I'm giving them a few days, and we hope that we'll see a lot more people who have masks on. I'm heartened, frankly, that we are seeing, and the culture, I think, is moving in this direction. I think when you have two big companies, for example, where virtually everybody shops, Walmart, Kroger, in Ohio, that's a real trend. So we're going to give it a little while, and I would not rule that out as we go in the future. But I think, again, people rather be asked than rather be told. And the bottom line is how many people are being careful, because masks are important. But as we learned and we hear all the time, we heard from the health directors today, it's not just masks, it's people coming together. And there's only so much that, we can get into people's lives. Ultimately, it's going to come down to what they do when no one else is looking. What they do, do they have that block party? Do they have that party in their backyard where they've got a ton of people there? These are things that we can't control. But in the end, if they're armed with the sufficient facts and the evidence, and they see what a real threat that this is, and they know that we could become Florida in a darn short period of time, I hope that convinces them. So we'll see how good I'm doing at convincing people in a few days.
Thank you, Governor.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. Based on the current trends in those 19 red counties, and especially in light of the case numbers increasing among young adults, what concerns you about college students returning to campuses at University of Dayton, Wright State, University of Cincinnati, Ohio State, in mid-August, which is just 4 weeks away?
A lot. I think everybody should be concerned. The colleges are doing what they can. Some of them have alternative plans. Some are going partially distance learning. I think the next few weeks are going to tell the tale, frankly. We're talking about K through 12. We're talking about college. We all want kids back in school. What we do today, literally today, tomorrow, the next day, is going to determine whether that occurs or whether that does not occur. And it's not going to take an order from Mike DeWine. People are going to figure it out. And if these trend lines continue, if we continue to see more of these counties, like I said, it's not going to take an order. You're going to see colleges that are going to be dealing with their customers and their clients, and people aren't going to want to come back. parents won't want to send their kids back. So we've got to get control of this. We've got to get control of it now. We're 4 weeks away. You're absolutely correct.
Thank you.
Hello, this is Jessie Bulmer with the Inquirer, and I'm told I'm the last question. You've talked about the importance of, the dangers of traveling to hotspots. You've also said repeatedly that Florida is a trouble area. Are you planning to go to the RNC events in Jacksonville?
Well, again, I don't have a crystal ball to see exactly how it's going to take place yet. I'm a delegate for the president. We'll see. I'm not going to make that decision. I don't have to make that decision. Quite candidly, virtually every waking hour, I'm focused on Ohio. And the thought of even being away from Ohio that long a period of time is probably not something that I think is a great idea, but we'll see. Well, thank you very much. Unless there's some breaking news, we'll see you all back on Tuesday, and I hope everybody has a great weekend. Thank you very much.
Governor DeWine wrapping up his Thursday afternoon press conference after last night's really State of the Union address as he was pleading with Ohioans to wear masks, saying again, reiterating, I'd rather ask than tell. And he's continuing to ask. But now, as of 6 p.m. tomorrow night, 60% of Ohio, because they are in alert red status, is under a mask order.
Already been under a mask order. Locally, they are doing that. Now he, as the governor of the state, is saying it is time for you to put a mask on. Still, again, talking about a mandate and order, but not going that far. And the counties that we're dealing with here in central Ohio, Delaware County, Licking County, Union County, Franklin County, Pickaway, Fairfield, and Athens County. Many of you in Athens County watch us as well. All of these counties now under red and now going to be dealing with a mandatory. And it's interesting that he talked about Athens, and the students are not there. He's worried about if these numbers look like this right now in Athens County, what are they going to look like when the students return back to Ohio University? Let's toss it on out to our colleague, Adrian Robbins, who's standing by at the news conference right now with an update of more on what the governor had to say. Adrian.
Well, Darlene, that's a great point. Some of Ohio's biggest universities are actually in counties that are at a level red right now. Obviously, fall semester starts very soon, so that's absolutely a concern. The governor said that should be an alert to those counties like Athens County that we don't want to be at this level and then welcome all of these students back at this level. He said we need to work hard to downgrade ourselves from that level red, he said, or the universities may do it themselves. Now we're up to 19 counties here in Ohio. They're up to a level red. Just a week ago, we were around a dozen counties. So obviously all of those new counties will be welcomed in with a mask mandate tomorrow night. But the governor still not doing a statewide mask mandate like so many other states we've seen done. Today, he said he was giving Ohioans one last chance to make the choice themselves. That's why he didn't mandate masks last night. But the governor, going through each county, he's talking about many of these counties are seeing wide community spread. He said a lot of the cases aren't necessarily coming from those block parties anymore, but they're coming from just people going out into their communities. So he is urging everyone to be vigilant and careful right now, especially if you're down in one of those yellow counties. Many people feel like the coronavirus isn't that bad in their area, but he said no county is green because everyone is at risk for the coronavirus. And also Dr. Thomas from OSU Wexner Center joining the briefing today, and what he said is this should serve as a forecast almost. He said we don't want to see the weather forecast when it's already raining. We need to take it as a warning and act now. And obviously we're going to be hearing from the governor again on Tuesday. At that point, we can see what kind of health orders he could be issuing. But for right now, he just continues to plead with Ohioans to make the choice themselves to wear a mask and stay vigilant.
Adrian, thanks so much. Another 1,290 cases today, so the numbers continue.
And 28 deaths, and he says we have been averaging about 21 deaths, but but yesterday or within the past 24 hours, we've had 28 deaths, bringing the total number here in the state of Ohio to 3,103 deaths, 9,324 hospitalizations since this pandemic started.
That's 115 hospitalizations up in the last 24 hours. ICU beds are up as well.
Yeah, and I love it how the governor not only asking today, asking people to wear their mask, he says, take some time and pray about it. Be responsible about what you are supposed to be doing right now in the state of Ohio. And you know what the numbers look like. You have all the information. He's been very transparent, cutting his news conferences down from every single day to every Tuesday and Thursday. And he said last night his goal at 5:30 was to catch people coming home from work and just have a conversation with the citizens. That's what it was billed as yesterday.
Well, this is what we talked about before the governor spoke today. Is he going to change anybody's mind? If you believe that you don't have to wear a mask and that's your right and you're not going to participate in this group helping one another, is he going to change any minds?
And he could not say anything when one of the reporters said we've got 24 states already under that mask mandate, and you've got 6 of them, red states, just within the past couple of days that did so. Yeah. We can keep talking about this, but we're going to, of course, keep everybody up to date on what's going on at First at 4. We're going to be back with you about 30 minutes.
Darlene Hill, Brad Johansson. We'll see you at 4 o'clock.